Well, thank you all very much. It is truly an honor for me to stand here today before you as the president of our Illinois State Medical Society. ISMS has a long and storied history of over 175 years. I too have a long, and some might say storied history with ISMS as well. I became an ISMS member back when I was a medical student at Loyola. In fact, I've been a medical student for I've been a member of ISMS for over half of my life. Organized medicine has been very important to me, and ISMS has been a home to me in organized medicine. I have grown up with the camaraderie and professional growth of this society throughout my entire career. I've always known I wanted to be a doctor. My parents tell a story of when I was 8 years old that I asked for a stethoscope and a Merck manual for Christmas. My father was a pharmaceutical representative, and so my interest in medicine ran in my blood. At a tender age of 8, I wanted to be a pediatrician. And the reason why is because every time I would go see my pediatrician, you never felt good. But after I saw my doctor, I always felt much better afterwards. And I wanted to be able to do the same thing for people someday. Like you, I did not go into medicine. Oh, sorry. My father was very fortunate to have connections for me. And so when I was in high school, I actually got to scrub with some of our local orthopedic surgeons. That's something that would never happen in today's world. That's what really spawned my interest probably in surgery more than anything else. And through some of those relationships, it helped foster me and help guide me in my medical career. This desire to help others is why my passion for being an advocate for healthcare and reform through ISMS and our partners in organized medicine. It's my firm belief that so many of us are drawn to this profession to help people and to help our patients feel better. And that's why I particularly am passionate about eliminating one of the frustrating barriers to care that plagues physicians and patients alike, and that's prior authorization. Like you, I did not go into medicine to do paperwork. I liked working with my hands. I've been around medicine all my life, and I wanted to help people. I'm a thoracic surgeon. By the time patients get to me, they usually have some pretty serious conditions. I couldn't have planned this any better, but Dr. Schwartz yesterday laid it out pretty good for me. I'm the guy. I trained for over a decade to gain expertise and experience to assess patients, formulate treatment plans, and execute complex surgical procedures. That's why it's so frustrating for me when bureaucracy slows down this process and blocks me from taking care of my patients. Prior authorization requirements from insurers remove physicians from the communicating chain and determining the care of the patient. It places medical decision-making in the hands of distant administrators who have not seen the patient. More importantly, these add layers of bureaucracy, interfering delayed patient care and increasing potential adverse patient safety outcomes. One example in our area right now is there are some insurances that will not allow our oncologists to refer to the appropriate surgeon. That referral pattern has to go through the primary care physician. And I know many of you know that in some of our rural communities, we have an ongoing shortage of primary care. And this can sometimes result in a delay in patients getting the appropriate care that they need, especially these oncology patients are exceptionally vulnerable at their point in their journey. In Illinois, we've already made great progress in prior authorization reform compared to other states. In fact, we are only one of 10 states that has prior authorization on its legislation. Starting in 2019, ISMS led Your Care Can't Wait coalition, bringing together other healthcare organizations and patient advocacy groups to fight for this landmark Prior Authorization Reform Act, which was passed in 2021. Under the law, Illinois requires insurance carriers to respond to prior authorization within a defined maximum timeline of 48 hours in an urgent situation and 5 calendar days in a non-urgent situation. And more importantly, qualified medical professionals will be making these insurance coverage decisions with more transparency about the process. In our state, prior authorization is more of a peer-to-peer process instead of a faceless bureaucrat who has no background or training in a medical specialty making that decision. This legislation was real achievement and made a difference in improving the care of our patients, but we still have a lot of room to grow. In 2023, prior authorization reform was amended to strengthen and provide further protection for patients with state-regulated private insurances and those in the Medicaid managed care programs. This latest law ensured that provider directories are updated on a regular basis with correct information. Patients need to know that their healthcare provider listed in their insurance provider directory are actually in network and accept new patients. It's also important for them to know the conditions for which they treat and not treat. In 2023, the Act protected patients by banning the so-called junk insurance plans that do not provide adequate coverage for patients and ended the unchecked rate increases for large group insurance companies. However, from a physician perspective, the biggest win in 2023 amendment was the ban on stepwise therapy. Insurance on state-regulated plans can no longer require that patients fail first on one treatment so they can access medications or treatments that their doctor originally prescribed. Step therapy causes patients to be sicker and symptomatic for longer and imposes unnecessary roadblocks to their care. The treatment decisions we make every day are often time sensitive. I recall a patient that I was asked to see who was suffering from a tracheal stenosis, secondary to a COVID intubation. The patient was actually short of breath. And after extensive discussion with the patient, and like I said, I couldn't have planned this any better, but Dr. Schwartz laid it out for me, okay? Of taking care of a complex patient, the decision was made that we were to do a tracheal dilation on that patient. My hospital required that whenever we did a complex airway procedure that I had an ICU bed available just in case. 2 days prior to the patient's procedure, the insurance company contacted my office and said they denied the claim and they wouldn't cover the procedure and that I needed to do it peer-to-peer. So I called. When I contacted the administrator there, they were in Eastern Standard Time, and guess what? We're on Central Standard Time, and so they were out of the office. So we played phone tag for about a day and a half, back and forth, me calling them calling me, vice versa. Finally, it became about the night before I was supposed to do that procedure, and I hadn't canceled the operation because it's much easier to cancel the operation the day of surgery than it is any other time if I want to make sure I can have the opportunity to still do that procedure. So I told the insurance company, I said, you know, I've been messing with this for 2 days, and I'm writing in my chart right now that I'm releasing myself of all liability of this patient. I'm putting all the liability on the insurance company for not allowing me to do this procedure. If this patient has a complication, I want you to know that it's on your hands. Well, guess what? Magically, the right administrator called me. And after a very short discussion, about 5 minutes, the case was approved and was taken care of. This probably took about 2 hours of my time to get this actually taken care of. And that's time that I could have spent helping take care of other patients. It's very disturbing to me how corporate interference can cost this patient and their ability to do something such as essential as breathe. It's clear that more change is necessary. We're pleased with the progress we've made here in Illinois so far. However, there's more reform that needs to be done. All plans regulated by Illinois Division of Insurance are what have been covered so far. So what that means is that many people who are covered under their employer-based regulated plans are actually under a federal level and under ERISA law. Everyone in Illinois deserves equal footing on insurance protection. It shouldn't matter who regulates your plan to ensure that you get the care you need. That's why ISMS is continuing to collaborate with national partners such as the AMA to work towards federal prior authorization. Here at Illinois, ISMS is continuing to push additional reform. In 2025, ISMS is working on proposing legislation that would prohibit state-regulated insurers from requiring prior authorization for coverage of chronic conditions such as multiple sclerosis, rheumatoid arthritis, lupus, and diabetes. We are working to prohibit insurers from requiring prior authorization once a patient has been consistently treated with the same regimen for more than 12 months. These reforms will help ensure continuity of care for our chronically ill patients who often face long struggles to work with their physicians to find a unique treatment regimen that actually works for them. It's time to remove third-party insurers from physician-patient relationship and let doctors do the work they were trained to do throughout our lives. Physicians are doubly impacted by the burden of prior authorization. Not only do we have to deal with the bureaucratic quagmire of having to navigate the rules of various insurers, there's property insurance systems, we have to fight them for appropriate reimbursements. You know, at the end of the day, all of us probably at some time will be a patient. What's more is every legislator will probably be a patient at some point in time or have a family member who will be a patient at some point in time. We have an opportunity to build common ground with our elected officials and continue to grow upon the successes we've made, fighting for patient rights to access care that we, their doctors, have identified for them is a win-win for everyone. ISMS is there to lead that battle in the next phase of prior authorization reform and help us continue to make incremental changes. Help us to put focus on health care back where it belongs, improving patient care over insurance companies' profits. I realized early in my career I would need to be an advocate for my patients and make sure no external forces were blocking me from getting my patients the care they needed. That's why that led me to join ISMS and dedicate my time and my energy to volunteering with this organization that has done so much for patients and physicians in Illinois alike. I'd like to take a moment to thank everybody, and I'm going to name some people. I'm going to apologize if I leave any names out, but I especially want to thank the ISMS staff, Al, Suzanne, Cheryl, John, David, Aaron. I apologize to Haley right now because I am not used to reading a speech, okay? I am used to standing up and I can talk to you for 30 minutes, 40 minutes, you name it, on about anything, okay? But Haley likes to try to keep me on track, and I'm going to apologize to her right now that I'll do the best I can this year. I look forward to working with Jana and Rebecca as we embark on our adventures this year. And in closing, I need to thank my wife, who I could not do what I do if I didn't have somebody behind me, encouraging me, supporting me through every step of my career. My kids, Ellie, Jake, Jack, Clayton, Josh, and Jillian, they give up time of their dad not being there for me to do some of these things, and I can't thank them enough for that. The support my family has allowed me to give has helped me build both a professional and volunteer career, and has led me to stand before you today as the president of the Illinois State Medical Society. I hope that you will join me in our fight to put medicine decisions back in the hands of our patients and doctors. Thank you.